Why tendons? I think I got bored of strength training. Tendons is difficult for me to grasp, the science of tendons. It's a struggle to figure out what's going on. That's why it's fun. Strength and conditioning, for me, is not. Boring.
Welcome back to another episode of The Good Pod. We have good mugs today. Thanks to Bobby. Appreciate you, Bobby, man. Appreciate you.
Good mugs.
We got Dr. Ross in the building. Shouts to Dr. Ross.
Hey, he brought something in today.
Okay. Shouts to
He
that.
actually is a doctor of physical therapy from New York Medical School, and he wants everyone to know
College.
that.
Yep,
So he brought
yep.
a sign in there.
And we have Jake. Jake, how are things, man? How are you?
I'm good. Ross, I like how I wouldn't even know you're a physical therapist.
Yeah, dude,
I like that about
that's
you.
the best compliment I could get, baby.
And you never, I don't know, do you have doctor in your IG or not?
In my ID?
IG.
No, your IG.
Oh, my
Your
IG?
Yeah.
No, I have DPT because I couldn't get Coach_Ross. TikTok, I'm Coach_Ross. So I did Coach_Ross.
Jake,
DPT.
one time in the gym, we had a group of kids there, and I was like, do you guys know what DPT means? They're like, department. They had no idea what DPT meant at the end of his name. I said, I told you, nobody knows you're a physical therapist.
It doesn't even matter. I'm in Lifetime, and every trainer walks around with DPT, and it stands for Dynamic Personal Training. What a
I've seen that.
scam. Ridiculous. Anyways.
Jake, why tendons? What's your fascination with tendons, bro?
Why tendons? I think I got bored of strength training. I was a strength coach for maybe a decade, and it was actually very difficult at first, maybe for like 7 years, because you just copy and paste. I tried to learn from everyone, and then I just realized it's so like abstract, and people are just making things up that you have to do this or you have to do that, and I realized everyone for the most part is making things up, and there's not a whole lot of science behind it. So I was just like, you can just pick and choose whatever you want to do in the weight room, and it's probably going to work fine. Versus tendons is difficult. Tendons is difficult for me to grasp. The science of tendons. It's not an easy subject matter. Versus strength and conditioning is like, I mean, you could do stuff in year one and learn stuff for 50 years, and then you're going to still be coming back to probably the foundations of what you've been doing. Versus tendons, sure, you probably are doing similar things to what they've done maybe 20 years ago. Definitely not 50 years ago. Definitely not 100 years ago. And it's a struggle to figure out what's going on. That's why it's fun. Strength and conditioning for me is not. Boring.
Yeah, pick things up.
That's why I got into tendons. Yeah.
Yeah. What has anything changed? So you started researching tendons, I'm going to say 5 years ago, maybe a little bit more. You've been in the woods reading about tendons, researching tendons. What's the biggest thing that's changed in your mind, in your view of how tendons work?
Oh, wow. Okay. I actually don't know. I think I posted a reel yesterday about tendon stiffness and tendon compliance, and I put it up, and then even like 5 minutes later, I'm like, I don't know if that's true.
I love that.
So what's changed? I think I've gone. So I wrote Jumper's Knee Protocol Science. I wrote a science foundation maybe in 2020, and I had only really been looking into tendons for a few months, maybe like 6 months, and I put that out, and I think it was just beginner's luck that a lot of the things in there are accurate. And now, fast forward 4 more years, and it's like I'm digging deep into everything, but what am I really pulling out of it? Not a whole lot, just more confusion. So yeah, I don't know if you guys follow the physio Greg Lehman.
Yes,
He
love him.
always, I love, because he'll talk about, so what I've done the last 4 years is dig into the patellar tendon, but it's like, how does all of this work change my practical application? And I can tell you not very much right now, at least. But I'm hoping in 5 more years it will change my practical application.
Well,
Because it's really just common sense. Like, it's really good common sense loading and common sense rest times for people. And that's usually how tendons are going to stay healthy. When you get older, the metabolic influences. But I'm going to keep digging into the interfascicular matrix, the gel in the tendon, and how the collagens, the helixes, and the cross-linking. But it's like, how does that change what I do day to day? It doesn't change much from outside of just good common sense.
Jake, this something that I really like about Greg Lehman, especially when I was in school. He's somebody that I really lean back on when I started looking at, okay, I'm in ortho. I have all of these people around me telling me all these things that matter, and I've known nothing. And then I'm doing my own little research, my own little digging, and then I hear oh, movement optimism. Like, oh, wait, what is this guy talking about? This guy's wrong. Like that, like biomechanics matter. All these things matter. So his whole thing is like you don't really know. There's so many influencing factors. Is there specific times that you would say right now that, okay, this matters when it comes to if I get this type of image from somebody that I'm looking at, I get this MRI, I get this ultrasound, I'm actually going to do something differently? If the symptoms are the same, I'm actually going to do something differently. Is there a time where that happens?
Probably not. I think the role of imaging, if someone comes to you guys with a tendon pain, and I that's probably the population, right? Like basketball players that are experiencing some type of tendon pain, they come in, they get a tendon pain. I would only really suggest imaging if you want to rule out other things, like maybe if you feel like they fractured their patella or something, and you're going to pick that up on an X-ray. And then we know it just rules out other things, or it could rule out the partial, like it could not a partial, it could rule out a complete tear, but you'd kind of know that. It could just rule out other things, but sometimes the imaging is bad because you'll come back with chondromalacia patella or something, and it's like that is not useful information. It's telling people they have wear and tear of their cartilage. Yeah, everyone has that. But yeah, what are you gonna do differently? I don't think there's really anything. You want to rule things out though, because like you could get cancer in your tendon. Yeah. And like you want to rule that out. So I'm not against all the imaging. It's just when you go get imaged, you're probably going to come back with a laundry list of things, and that scares people. That scares people into exercise. So the whole Greg Lehman thing, the movement optimism is like, you see this with the low back. How many people have bulging discs and they're asymptomatic, they don't have any pain. And it's the same with tendons. You can have, there's so many terms that they have for problems with a tendon, and it could mean absolutely nothing. So like I could go get mine imaged right now, and playing basketball and jumping my whole life, I'm sure my patellar tendons look terrible. I don't need that information. I'm fine. It's based off of symptoms. Are you able to do what you want to do? Do you not experience pain? Continue doing that. You don't.
You had a specific post about this with the it was like the burnt toast with and I commented on this, and I think Greg commented. I commented on Greg's thing, or he commented on your thing, whatever. And it was two separate groups of whatever. They were males, military training, something, and one of them did nothing, and the other group did some type of like dynamic warm-up type activities. And what you saw was the tendon was healthier. I'm not 100% what the details are, but the tendons were healthier in the group that did like the dynamic warm-up type activities versus the other group. I'm not sure what it said about pain. Was there anything in there about symptoms? Just like personal curiosity about that?
Oh, I don't remember, but I don't think, just from my recollection, I don't think they had pain. The thing is, if you have pain, you're going to have abnormal structure. It's going to be compromised. And I think the path is you take a completely healthy person and they go down this path of overloading or underloading. So like overloading and underloading can both be very bad for a tendon. So like laying on the couch and doing nothing is bad for your tendon, and going and playing 6 hours of basketball out of nowhere 5 days a week is bad for your tendon. And both will probably not lead to pain. They might not lead to pain right away, but they're going to cause structural problems of the tendon. So if you there's something called the ultrasound characterization, a UTC scanner, where you can scan the whole tendon. It gives you a 3D image, and you can, the color coding is it should be completely green. That's how healthy, that means it's healthy. When it gets blue, it gets a little unhealthier. When it gets red, a little bit. So I'm just using this to talk about that study. They imaged everyone with that UTC scanner, and they saw that a lot of the tendons, even without pain, have this compromised structure. So if the structure is compromised, you're probably leading down to pain at some point, or dysfunction at some point. You could be leading down into that. So if you got the structure healthier, you're not going to experience pain, because a healthy tendon does not experience pain. So yeah, they did it was a military thing. And I guess talking to my military friends in strength conditioning, a lot of them are poor athletes, terrible athletes. Like you'd think military people would be competent at movement and competent at strength and conditioning, and a lot of them are not. So yeah, one group just did the military training, the other group did the military training with like bird dogs and hip airplanes and these dumb things that you're like, this is not going to be enough load to strengthen a tendon. And I think it was their Achilles they looked at and their patellar, but it made these health benefits to their tendons. And my only, just logically, I'm thinking, I bet you it gave them a little bit more movement competency so they could load other tissues, like they could load their groin or they could load their glute instead of loading their patellar tendon and loading their Achilles tendon, because they had a little bit more quote unquote like movement options. So they became just to have a better foundation of a human, and then you don't go to get the tendon pain. So you could reflect actually. I wish there were more subgroups of tendon pain, because we could take you probably have in your head of like, you have the best athlete in the world who's competent at everything, and they get an awful case of jumper's knee. And I think that person, they got jumper's knee because they're able to load their tendon so much more than anyone has in the history of time. And then you get another kid who's just such a poor athlete and they get the same tendon pain. And it's like, I think those rehabs could be completely different. That kid that sucks at everything, let's do the hip airplanes and the dumb things. And the kid who's good at everything, like maybe you need to really be careful about the loading that they're experiencing while you maintain everything else. But I wish there were more subgroups so we could get a better idea of why does this poor athlete have jumper's knee and this amazing athlete has jumper's knee. And we just don't have that classification yet.
It's something that I wish that they did when I was looking at it was they just did a pre and post, right? And I wish that if they did it more like intermediately, maybe you're going to see like, okay, after 1 week, was there a gradual change in what's happening? Or is this something that's like, I wish that they went a little bit more in detail. I wish that they talked about pain a little bit. Like what are the things that they're experiencing there? I honestly don't think that would be the case. I don't think that them doing like bird dogs and all that stuff would change the strategy in which they move. I don't think that I just wouldn't put my money on it. But it's very like a confusing thing because I have no idea like why would that happen and what does that mean? What does that mean? What do we do with that? But that always caught my eye. I was looking at that for like 2 hours. I'm like, what's going on here? Like, what is this? And I don't comment.
I would think they would have to be incompetent in the first place. Like at those type of movements, it would have to be somewhat challenging.
Yeah,
because if you give it to a person that masters it right away, I don't think it's doing anything at all. But if you give it to someone and they can't even like stabilize their hip, like that's true. Just use like the kinetic chain idea that like if this joint isn't capable of what it's supposed to do, it's probably going to go to the next joint, and then maybe those tendons or those joints experience a little bit more loads. It's just speculation, and it's like a little bit of logic. But one term I do like is just because it's logical doesn't mean it's physiological. So I was kind of thinking of that. And tendons give that to you because a lot of things logically make sense, and then you look at what's going on and you're like, that goes counter to what I'd think. But for me, it just justified, just be good at basic things and your tendons are probably going to be healthier in the long run. You know what? You could even talk about the metabolic. Maybe they had some metabolic influence there. Maybe a little bit more activity actually burned a little bit of sugar, and maybe they had bad diets or something. And that could have helped the structure as well, because you can get like type 2 diabetics with uncontrolled blood sugar, their tendons get very unhealthy, and if they start to get better blood sugar, their tendons kind of rebound. And I think nowadays with young kids eating candy, playing video games, obesity, the things the metabolic influences that probably should only affect you when you're like 40, 50 years old, they're probably affecting people now at 15 to 20 years old, because people are just more unhealthy. The access to the foods, like the high sugar foods, there's so much, and I don't think we should have those in nature. And I think anytime you go so far away from nature, it's going to show up in something. And the tendons are one of those tissues where it will show up.
Yeah, it.
Should athletes that don't suffer from pain think about tendon health?
No. Not at all. Don't worry yourself. If you're gonna think about tendon health, then let's also think about joint health, and let's think about cartilage health, and let's think about liver health, and how many healths do we need to think about? So, it's an after the fact thing. Tendon pain is something you respond to. This might be contradictory to the whole talk about structure, but I did a show with Jared Antflick. I think he's out in London, and he goes around to maybe 13, 15 NBA teams, and he uses that UTC scanner. So he images the patellar and the Achilles tendon. I think it's every 6 weeks. So he looks at the health of the tendon. and they try to get all the tendons as healthy as possible, because if it is healthy, or if it is unhealthy, you're risking rupture. A strong, healthy tendon will not rupture. A compromised one will. And when you're dealing with $1 million athletes, let's try to get everything as healthy as possible. So for them, you're making millions of dollars a year. Yes, let's concern ourselves with tendon health. Maybe the athlete doesn't have to, but the staff should. But yeah, when you're young, I think it's just good. Just do good strength and conditioning. Do good training. Don't change loads suddenly. Like take 6 months off and then go play many hours a day immediately, because that's what will toast your tendon. But yeah, I think if you have good common sense, if you have a good staff around you as a high school kid or middle school, college, if you have a good staff that's strength staff, athletic training staff, coaching staff, which is not the case most times, definitely not the case. With the changes in load, coaching staffs will just throw players a ton of running, and I'm sure you're just toasting tendons left and right. They don't experience pain, but you might be setting them up for problems down the line. Yeah, athletes shouldn't concern themselves with it unless you get it. Yeah, because don't concern yourself with something unless it's not an issue. Just go and train. Go and train and have smart people around you that are helping you.
Most of these high school players don't have smart people around them, and 90% of the high school kids that I train are going to experience knee pain at some point. How should they go about treating it if they don't have access to this help you're talking about?
1 by 20.
1 by 20? Rip it?
No, I mean, like strength is very, if the Achilles tendon is connected to the calf muscle, the patellar tendon is connected to the quad muscle. If you keep those muscles strong, you're really set up well. I think every time you land, jumping is a little bit different, but every time you land, I think that impact goes into the bone and then it goes into the tendon. Then the muscle is the one that's going to dissipate that energy. And I think if that muscle sucks, I don't know. This is a speculation. I think it sticks in the tendon for longer. I think it makes the tendon strain get pulled longer. So if you keep the muscle stronger and healthy, eccentric strength, whatever you want to use, if you just keep your muscles strong, you're protecting your tendons. So yeah, for those kids, it's just like you're playing basketball year round. You should be lifting year round. Like find a good strength coach that can program so that you do keep your legs strong. And that could just be squats, split squats, leg extensions, basic things like that. You probably don't get many kids with Achilles. A lot of jumpers need though, and that's just general quad strengthening. Strengthen everything else. Strengthen the hamstrings, the glutes. Those are all good, but really make sure the quad muscles stay strong, and that's going to set someone up to probably put less loads through their patellar tendon.
Staying on this younger demographic, are you treating the common Osgood Schlatter any differently than you're treating jumper's knee in older populations?
Yes, that's usually the first thing I'll ask. So you can, if someone comes to me and they ask about Osgood Schlatter, the first question is, are they immature or are they mature? So if you're immature, like pretty much before 17, you haven't finished growing yet. It's more of a growth plate issue. It's not really a tendon issue. It's you're kind of waiting for that to get resorbed for the person to be done growing. So with a young kid, it's a lot of wait and see. You wait and see. You try to make sure that what they're doing is not really aggravating things. I say gentle strength training, because I don't think you need to be going as hard as the older person who's completely mature. I don't think you need to be going on leg extension and trying to max it out like 200 pounds with a young kid or as much as they can do. I think that probably could just aggravate things even more. So it's a lot of patience and trying not to. Michael Rathleaf is a guy. Michael Rathleaf is a researcher, and he had some really great work on Osgood Schlatter. And even there's something called Sinding Larson Johansson. It's Osgood Schlatter that happens right under the kneecap, so where a typical jumper's knee is. So kids can get either of those. And a lot of it is trying to keep the kid in sport and active, so they're not getting these big peaks and valleys of loading. How it's like, my knee hurts, I'm going to take a few weeks off. I feel better, I'm going to go play again. And they get this big trough and then this big spike. And that's what you want to avoid. So you want to try to keep them active as much as you can. And then it's about getting the coach, the parent, and probably the medical staff, the strength staff, everyone on the same page to understand what this kid needs to do. Try to keep them active so they're around their friends. You don't isolate them and take them away and they sit on the bench, because that's bad for a young kid's mentality. And then just like trying to keep the muscles strong. But a lot of it's waiting. I don't know, Ross, would you agree with that?
Yeah, the activity part of it, I think I have this viewpoint, which is a subjective idea, that like people talk about warm-ups all the time. They talk about, okay, warming up before you do an activity will get you ready for that activity. It'll get your muscle temperature up. You'll be more ready to handle loads and you'll be safer doing it. But I feel like there could be a more general idea of like staying warm and what you're saying, not having spikes in your training. What is a warm-up trying to do to you? It's trying to acutely, you're trying not to have such a fast spike in workload because your body's not ready for it. And I think in a more macro sense, I think it applies to players or any athlete, if you can stay loose and you could keep that momentum going with your activity so that you do not have a spike. Because I do think a lot of it is neurological. A lot of it is response when it comes to the pain side of things. And how are you going to mitigate that response? It's going to, by constantly telling your system you're able to do activity in a safe way without pain, it won't send that signal as often. It's going to say, you know what, we're able to do this safely. You've proven this to me that you could do this safely. You yourself know that you could do activity safely. And so staying warm in that sense of showing yourself that you could do things in a safe way, I think that's massive. I think that's really big.
Staying warm, like not
Stay-
within the session. You're talking
Yes.
every daily
Every
type
day.
thing, yeah.
You stay
Yeah.
warm. You keep the momentum going and you don't stop and then start. It's every single day you go.
Yeah.
You know?
I think that's that. Yeah, I think that's a big issue. Yeah, that
Like if I lift
the brain piece. Yeah, if you remove them and then go play, like you need a lot of the pain thing is telling your brain that it's safe to load that area.
Yeah.
Because it's afraid maybe something's going to rupture, and sometimes you do get that, but it's pretty rare. So yeah, that's exactly it. Telling the brain and that's really what you're doing with rehab, anyways.
Yes.
Doing a graded approach, like your patellar tendon hurts. It's a lot of that is your brain just shutting it down, and you see them limping, and they don't walk downstairs right, and they play and they don't even load that one side, so they change the whole game. And it's like, we need to get your brain to load that joint again and tell it that it's okay. Same thing.
On a consistent basis doing that, yeah.
My observation is these PT mills aren't doing this. Like, this is not happening, right? You're going in there, you sit on the thing, they put the heat on your knee, you ride on the bike for 15 minutes, the doctor rubs your knee, for 4 minutes, right? And then you get set with the 17-year-old intern and you're over there not loading or doing anything, and they're telling you to take a break for 4 to 6 weeks and not do anything. And then they get done with that 4 to 6 weeks of not doing anything, and they jump back into the load that they were experiencing that caused the pain in the first place, but they haven't prepared for that load. Like, this is what I see happening.
It's generally wrong. For athletes, it's generally wrong and I always hated on PT. For athletes, it's objectively they do things the wrong way because they don't know how to handle somebody that's doing that much activity because they're not. But for like the regular person that's coming in that doesn't do anything anyway, like doing pretty much anything is going to give you benefits in so many different areas that it will probably get you out of pain. Like if you're sedentary and you just sit at a desk for 8 hours a day, you could literally just like go say hi to a PT and you might get better. It's like a kid that just it's a kid that can just look at weights and get stronger. Like I feel like it's a similar type of thing. But for an athlete, like, and you have stories of yourself going to a PT mill where it's like, all right, if I'm going to go sit on a bike and my heart rate's not even getting above like 100 and I have knee pain and I'm just sitting there, and then he rubs my leg, it's like, it's probably not going to do anything like for you.
Yeah. No, when I'm 17 years old, I was blessed. I had good trainers that knew what they were talking about, not like the kids I was mentioning before that don't have access to this. And whatever I was dealing with, I went to the PT and it would be, all right, go warm up on the bike for 15 minutes. I said, I'm warm. Let's go. And they're like, they didn't know what to do with me. Because I'm not saying I knew more than them, but I knew I didn't need to sit on a bike for 15 minutes. Like, I'll walk here if you want. Can we do something that's going to help me? I didn't know exactly what that was or what it meant, but I knew sitting on a bike for 15 minutes is not what I needed. I didn't need to go to a freaking doctor to sit on a bike for 15 minutes and have them, put some heat on my knee. That's not it.
Yeah, I've always hated PT. I've been in PT, physical therapy for my jumper's knee and then for my lat tendon.
Yeah.
And it's like, I think I'm like 500% weaker outputs when I'm in a PT room. Because it's just not conducive to it. You're surrounded by old people that are doing band exercises, and I'm like, I want to go and dunk a basketball again. And how are you going to progress me there? And I don't think they could answer that. So I like Andy McDonald. I talked to Andy McDonald a few times, and he does this I think it's strength and conditioning for rehab professionals. He has a course on it, and I love the way he puts it. Where it's like, so when someone comes to me with like post rupture patellar tendon, I pretty much say, listen to your surgeon and PT for like the next 6 months, and then you can talk to me because I want that thing to heal. So like I kind of, in the acute injury sense, when we know we have many months before you're going to be back to play, go to the PT and do the medical route. But then there needs to be this bridging of the gap where you start to get handed off to the strength coach, and then the late stage rehab should probably be run by the strength coach because they know how to prepare somebody. Late stage rehab with most PTs is probably going to be awful, and then you just throw them back into sport, and then bad things happen. I wonder. This is speculation. I wonder what happened with McCaffrey when McCaffrey hurt his Achilles, and then he goes back and he hurts his knee. It's like, I wonder how much offloading and rest the guy had. It's big speculation, and it's like N=1, probably not worth it. But it just makes me think that there have been probably millions of cases of athletes that have something like let's just say a jumper's knee, and they take that many weeks, many months off, and then they go play, and then they get a stress fracture in their foot. Something that's like completely unrelated. And it's like, probably because that rehab sucked. It didn't bridge the gap, and then you had a huge spike in load again, and it was something that was complete, like your knee hurt, and now you hurt your foot. But it's like all of the tissues get detrained when you do bad rehab.
The problem is the PT mind is very trained in a way where it's biomechanically driven. So what they're most, and it seems like this shouldn't be the case at this point, but this is still the case. No. It's like you hurt your hip, and because you hurt your hip, your glute med is now not functioning right. And now that's why you hurt your knee. And then you hurt your knee. And since you hurt your knee, your foot's going to shut down. But it's also, my whole theory with everything is that it all starts with PT. PTs want to make themselves seem bigger and better than everybody. And I'm not in the PT mix right now, so I'm out of that world. But just in this conversation, like, that's just the truth. It's like strength and conditioning coaches want to match PTs, and they take things, they take ideas, and they try to apply it to a strength and conditioning context. When what you're saying of like, dude, like freaking train hard, prepare yourself for your sport. Like, don't do something in the name of like, oh, we got to fix you biomechanically. It's like, you don't know anything. You don't know what's going on. You're just making things up that aren't true. When he gets hurt, it's 100% due to deloading. It's 100% his tissue in that moment wasn't ready for that thing, regardless of how it broke down. I do think back to your point for kids that are after they get injured, I do think going to PT, like for most, like after like post-op, like type of things, that's a good idea. Like PTs are going to say, like, they're going to pull you back. All right, relax. You just tore your ACL. Don't go freaking jump. Like, be disciplined when you're 8 weeks in after a thing, when that's like 8 to 10 week mark, like a re-tear after the surgery. Yo, this is the moment you have to stay disciplined with it. I think that's awesome. But when it comes to like those just like acute things that are just like, or chronic pain, they suck.
Yeah, I talked to Enda King a long time ago, and he said begin with the end in mind. And it's like, if you could do that in rehab, you wouldn't have such bad rehab. Like, what is the ending for this person? Look at the what do they need to be ready for the season, or what do they need to be ready for on a weekly basis? 3 hours of basketball practice 5 days a week. And that's what you should have in mind at the start of your rehab. We need to build you up to that point. And a lot of it is just handing people off and, oh, we fixed you loaded your left leg more than your right leg, and we fixed that imbalance. Go play basketball again. It's like, no, that's not, that's the preparation, just Greg's thing, the movement optimism of like, when do biomechanics matter? And I'm like, I think probably not. Most of the cases, they probably don't. You could people move this way. Let's just try to prepare them the best we can. Like, you could pretty much be a meathead. Just use like a little bit of math, a little bit of logic, and people are probably going to be fine. Do more of that than you do like gait analysis. Like my knee hurts. Let's do a gait analysis. It's like, your knee hurts. Let's try to keep you as active as we possibly can, so you're always staying ready. And then let's add in a little bit of rehab to try to strengthen things, and maybe take a day off here or there if you're just overloaded. But yeah, to be like, let's overhaul everything about you, and in the process, we're going to detrain you from everything else. That's why you're hurting people. Like, your method to fix people is actually hurting them. You just maybe not see it right now, but it's down the line. It's happening.
One of the biggest problems is that players don't understand that pain is normal. Pain is something that everybody goes through, and whether you want it classified as normal or classified as typical, it doesn't really matter. People go through pain, and what they don't understand most of the time is that that is normal. And the questions when they're in our gym, and I think we handle this extremely well, most of the time when it's, sometimes I get a feeling of like, ooh, like be a little bit careful, a little bit caution, like what are they saying here? But 95% of the time when a player comes to us about pain, it's shut up, go work, stop complaining. Like, most people would look at that and say like, oh, that's extremely uneducated and extremely ignorant thing to do. But most of the time, players, like 17-year-old kids, 15-year-old kids, catastrophize their pain, which is like, seems ridiculous. Like, go freaking play. Like, you're fine. You'll be fine in 2 weeks. Like, go play. And if it keeps hurting, we monitor things. But like, you have to be good on the court. It's not about, yes, you want to get out of pain, but you have to be good on the court. It's not about fixing an imbalance. It's about how can we make you better when you actually go play on the court, you know?
Yeah, it's like you're almost enabling the behavior when you cater to them. And I hate that. Yeah. I had a young kid, like a fatter hockey kid, and he had Osgood Schlatter, real young. And I was with my friend Nate, and I think we were gonna like help this kid. You know, we had a group of like 30 kids. We were gonna do a little bit focused help on, and it's like, no, let's do not do that. Let's just leave the kid. And I think he just felt better in a few weeks. But when you take them, and maybe this is like, I think we can all, maybe when I was a kid, my mother was so caring, and I don't have that feeling from my dad. And I'm sitting in a room with, we're all guys, that it's like, I don't think that we need to give that motherly love. You know, do we need to give that to a kid and enable them to be even softer, or should we just be hard on them? Like, ignore it. Almost don't allow it to be like, where this, like your gym, I've been there now a couple of times, like your gym is moving along, and we're not going to wait for you. It's not going to change for you. Either you're on board or you're off. And I think that environment probably decreases a lot of pain symptoms. Or they're just, or they're gone.
Or they're gone.
Once a week, I'm in a kid's ear. Stop looking at your mom. She can't help you. She can't help you. You're here. Be here. She's up there. She can't help you. Stop looking at her. And then I'll go talk to the mom. Get the heck out of here. You can't help him. You've done enough. You got him here. Let us work. And when they buy into that, they get better.
And what I will say is that to contradict it, it's like, there definitely are times where it's like what you said or how you're moving or what you look. It's just like, I will use like the subjective call of like, all right, that's a little bit different. Like the way you're describing that, like if a kid, as obvious example, like if a kid goes on the floor and he's screaming in pain and he just got hurt, it's like, all right, now I'm gonna go, like it happened with Ben. Yes. It's like he's there's a clear thing. It's a tough kid. He got hurt. Like he's on the floor. I'm like, okay, let's look at what happened. Let's tell you what to do. Call your dad. Make sure that like go check this out. Go to this person. Whatever. But yeah, most of the time it's just not the case.
Yeah, the catastrophizing is. That's why if ever I'm at family gatherings and someone has knee pain, they want to talk to me about knee pain. It is the last thing I want to talk about. I don't want to deal with that.
Yep. You did that to yourself.
Yeah, and the
they don't ask me anymore.
Ask you about
they know.
but people, the followers that I've had for a while, they know what I'm like, that I'm not going to enable them and baby them. So I don't get so many of those questions, and they know what they're going to get on the back end. It's like, for me, it's like, you have a lot of work to do in rehab, so get to it and then come back to me in 6 months and tell me that I fixed your knee. But I'm not going to walk you along the process and hold your hand. It's just not me. Find someone else for that. But yeah, and that's probably just me. That is what I needed my whole life, is someone not to hold my hand and for me to figure things out. So I do the same thing when I coach people. And if that doesn't work for them, they can go find someone else who will hold their hand. But it's just not me.
I was such a baby. Like, I'll admit it. I was the biggest baby ever. I've got 6 sisters, only son. I was the baby. I was always babied. I acted like a baby, emotionally immature everywhere. And it's like, I've come on the other side of that now. Going through everything that I've gone through, now I can experience the other side, and it's like, it makes me even harder on these kids, because it's like coming from what I experienced growing up, being so emotional, taking everything, wanting that, that white glove service or that special little touch, and then it's like now I'm on the other side of that, and it's like my mission, right? We're gonna freaking turn these little boys into men.
Yeah.
You got combo.
So I know you did Jump Attack, Tim Grover's Jump Attack growing up. What do you think about that program now, looking back at it? Because I did it. It was great for me. Part of it was because it was one of the first programs I did, right? It's kind of those newbie gains you get. But what did you think of it then, and what do you think about it now, looking back?
Oh, I don't. Yeah, I think it was good. It had all the movements you probably should be doing, like the lifting exercises, the jumping ones. I think some stretching. So there's probably some things in there
Right.
that are like maybe they're not that important. I don't remember completely what it was like, and I'm
It was
sure
a lot
I
of
was
like it
doing.
was a lot of like French contrast. It was
Okay,
like a
so it's
lift
paired.
into
It
a
was things
jump
paired,
into
yeah.
a stretch.
Yeah. I mean, that's great. I think the issue I had was I wasn't doing anything right. Like, I think for probably 5 years, I was just doing Jefferson deadlifts when I was trying to do normal deadlifts. And my knees were probably touching when I was squatting. But I figured it out. I had to figure it out all on my own. So if I just had a strength coach that was competent, but I'm in the middle of nowhere in the woods, and my high school was 15 kids. We don't have strength coaches here. So yeah, I had to figure that all out on my own. I think it's probably good, but I think most kids, like my case, they need someone to show them how to do things because they're
Yeah.
not going to, they don't know. YouTube is, you can go on YouTube and learn how to do a squat and deadlift, sure, but yeah, just having a little bit of guidance and as to learn the movements of strength and probably jumping and stuff, like that's just stupid simple. You can teach kids that so quickly. It is not a hard thing to grasp. But yeah, I think it's good. I mean, you got Michael Jordan on the cover. I had a lot of placebo effect going into that.
Yeah.
And it just you're just doing. It was basically just good, probably just good training. Maybe if I looked at it now, I would say there's some things that are not good about it, but it seemed like it was good. And I think a lot of things are. If there's a lot of the programs are just good programs, and you should just run them. And if you can get excited and get a placebo effect out of them, stack that for 5 years or 10 years, you're gonna start like for me to. I actually didn't really care about muscles for a long time, but I think it was probably like 6, 7 years into lifting. My sister saw me and I had traps and she thought I was like on steroids. And it was the first time that someone had noticed some muscle on me. But that was, I don't know, 6 years of just lifting. And it came then. And I didn't have I didn't want the immediate gratification. And then when I got it, it's like, okay, this is fun. I could keep lifting. But the amount of programs I ran through so many programs. And I think if kids are really curious about strength, they'll do the same. If they're not curious and they are good at their sport and they just want to get better, just have a good coach and listen to your coach. Yeah.
How does one stay athletic while building muscle?
Well, you run clusters. You run hypertrophy clusters.
I'm on phase 3.
Yeah. So you run hypertrophy clusters, but I think if for the most part, if you're lifting, you're going to build muscle, and if you're playing your sport, you're going to stay athletic. So you just have those two things. Now, for me, I have an 8-week program that does it better than anything else. So that's what people need to do.
By program.
By program.
I think a lot of the bodybuilding, if you are this is weird, like talking to basketball guys and then try to fit in bodybuilding, because the bodybuilding influence is more like a American football thing. Guys want to get huge.
Well,
and jacked.
it's still a huge influence, right?
Well, somewhat in basketball, but I'm saying like it's maybe a little bit less in basketball, right? Like the guys, some guys might not want to get super jacked, or they might even look down on it or something. Like you got example, if they don't like lifting, you got examples like Kevin Durant, who's looks like a twig, and they're going to be like, I don't need to be big. Look at KD. Versus NFL, you're never going to get that. Everyone's jacked. So, yeah, I just always was insecure about it, and I wanted to get jacked. So I have always had bodybuilding in my programs, and I was small and insecure, and now I'm big and insecure. So I never lost the insecurity. It's still there. Yeah, I think most people, if they just lift year round, good lifting, they're going to build muscle and strength. And then if they play their sport, they're going to stay athletic. There's not a lot of kids that go and do a bunch of lifting and they get slow and unathletic and they suck at their sport. That's because they stopped doing their sport. If you do your sport year round or you do some form of athletic thing, everything is going to transfer and work perfectly. The thing I think I did with clusters is like there is so much volume in there that it's hard to kind of do anything else. So it's like you need to make sure the lifting is high quality. Because if you're just grinding out set after set of 10, you're going to turn into someone who's pretty big and useless. Versus if you kind of maintain the quality in the weight of the reps, maintain the quality in the weight room, you're going to be a lot better off, and you'll probably be fresher to go and do some of your sport as well.
I think that's an issue for some younger athletes when they realize they have to build muscle, they start to drop everything else. I think that's a huge issue sometimes.
Yeah, if you just live in the weight room, it can work for American football because you have no one's putting on pads and playing football all year.
Right.
Basketball players are picking up a ball. They should be picking up a ball probably every day and going on the court.
100%.
Yeah, and if you're a basketball player and you don't do that, you probably just suck at basketball.
Yeah.
Like you're probably, if you're good, you're probably playing every day, most days of the week. Versus football, yeah, I mean, actually, I've worked with a lot of football guys. They're just huge and super strong, and then they suck at football. And it's like there's something lacking with the skill component or the speed. I don't know. But if you're a basketball kid and you're dropping basketball to go and get bigger in the weight room because someone told you to get bigger, you probably just suck at basketball because you would never do that. You would never do that if you're actually good at basketball.
I also think there's a realm of specificity in the weight room for football players. Like I think the specific component of you're actually moving a lot of weight, and in football you actually are moving a lot of weight. Like you're pushing against something that's heavy in football. In basketball, that's not really a skill that you
get
need.
into the rim, right?
No. Like pushing somebody.
Oh, okay. I see
like
what you're
you're pushing somebody, like that's like, all right, I could kind of see that, and maybe that's why they can get away with, okay, if you live in the weight room as a football player, all right, moving a lot of weight in the like in football, doing power cleans, like that not same exact, but a very similar thing of you're moving against an external body. Like that's something you really need in football. In basketball, it's like, all right, this is a general thing that you don't have to do it. If you do it, you're probably going to get some type of general benefit. I think the problem that people run into, especially coaches, is when they try to specify things in the weight room for something that they should just be doing on the court, and in the name of specificity, they lose intensity all the time. You see it all the time.
Give me an example.
When people when sprint coaches, they want to run faster, they'll do something extremely specific in the weight room. Like they'll do like a horizontal hip extension against something in the weight room with no context of like how this is going to translate. They're just saying, oh, we need to work on doing this part of the movement fast because this is the part where you're lacking speed. They'll just make some shit up and say, this is the part where you're losing speed. We got to work on this. And it's literally, they should just be sprinting.
They should be,
and they should just be working harder in the weight room because that's the beauty of the weight room. The beauty of the weight room is that it's a safe place where you could push your body to the absolute limit in a short amount of time. There's not a lot of places you could do that. Sprinting, jumping, 100%, but actually pushing your body to the edge of its ability in a very short amount of time, the weight room is perfect for that. You're sitting in the rack right now. You literally just put weight on, and in a 10-second time frame, regardless of what you're doing, you could challenge your body, your muscles, your metabolic system, everything. You can challenge yourself, and I think it's where people go wrong is they don't look at it as a general thing of like a human development thing, like kind of eating right, lifting, your mental state. It's like these are general things that, and then when you go on the court and do what you actually should be doing specifically, it will help you. But it's not the specific thing.
Yeah, now that you bring that up, it's been a while. I don't care too much to look at strength content, but yeah, people that would take a basketball player and show like the way they're cutting, the way their foot's hitting at a certain angle, and then they'll be like, "This is why we're doing this lateral rack push or something in the weight room."
It's ridiculous.
In my case, playing garbage LA Fitness basketball, but I've gone on many stints where I play probably 7 days a week, LA Fitness basketball for like a couple hours.
Still to this day?
No, not. I mean, I will get back to it.
Okay,
I'm sure I will. I'm not living around an LA Fitness, but
okay.
when I do that, it's like I'm going out there playing and dunking, and my lifting is like I want to get one squat pattern a week and one hinge pattern and one split squat pattern, and then upper body's all like pump work. But there's nothing I'm doing to hit certain joint angles. I'm just doing like I just want to stay strong. But I look at the strength coaches who want to hit the certain angles and be really specific, and I'm like, if you were in those athletes' shoes who were playing 20 hours a week of the sport, I don't think you would ever do that. I think you as a strength coach, you just live in the weight room and you're trying to get everything out of the weight room. You're trying to get everything that is already they get it with basketball and now you're trying to get it in the weight room. You should go and play some basketball, Mr. Strength Coach, and then
Yes.
you'll see like,
Yeah.
oh, all I should be doing is keeping my quad strong and my hamstring strong, and I'm going to be good. I think it's really just I don't relate to these people at all in the strength the force plates and the monitoring and everything. It's just I've never jived with it. I've never even wanted to learn about the technology. And that is a huge thing now. You guys probably see it. You see strength coaches and maybe kids too. They're wearing the straps to look at their player load and everything. They're wearing the whoop bands and everything is monitored and they're trying to optimize everything. And it's so anti-human. You're taking out just the human spirit element of just being, what do you guys say, a dog? Of being a dog. How can you be a dog when you look at your whoop band every single day? But when you're wearing your catapult, like, leave that to someone else. Leave that to someone else. They can manage that stuff. But if you're gonna hyper focus on these recovery numbers and everything, which have been proven to be pretty inaccurate in the first place, I just don't jive with it. I think keep things, do the sport, get in the weight room, do the basic things that you know you need to do. And if you live it, you would if you tried living it as a strength coach or a PT, anyone, you would realize what it feels like. That your body is so banged up. Let's just make sure my quads are strong, so my patellar is saved. Make sure my hamstrings are strong.
I don't know why it makes me think about this though. It makes me think about the guy who comes to the gym who doesn't lift, he doesn't do anything, but he has like the machine. He has that gun that massages you. It's like, where's the focus, bro? Like, what are you thinking about? You know,
Gabe, just pull up the clip of Combo in the gym with the massage Theragun for us. That's good. I had something crazy in my brain. My brain is on fire. I feel Alex should be here.
We'll do it again.
Yeah,
We got a couch. We'll pull the couch out. We get 4-on-1 with Jake.
Yeah, we'll get Alex here. I told Mark Howell, he was saying, what should I do to get my bounce up? What should I do? I'm like, all he does is make lifting videos. I'm like, okay, how much do you lift a week? He's like, 5-6 days a week. Okay, Mark, this is what you're going to do. You're going to lift 2 days a week. Go. That's it. Nothing changed. Just go. You say you want to dunk. Not going to even add anything. Just take away. You're going to lift only 2 days a week now. Dunking on people now at LA Fitness. Dunking on people's head. What did I do? He probably added three in an acute span. He probably added 3 to 5 inches to his vert, like weeks, right? And it wasn't adding, it was removing the things that aren't important. And a lot of people add things that aren't important all the time. Or they'll do too much of something that's not the thing that they should be focused on. The whole Whoop thing, people are measuring things that they'll never, they don't even know how to make a decision or how to make a decision accurately based on the measurements that they're getting. The problem with most people, that one of the great things about PT school, when I went to PT school, was we had like 2 or 3 semesters where we had a class on just understanding research and understanding. And I'm not at a point right now where I feel extremely confident in my ability to like read research, but that humility. And then when somebody else talks about something, it's like, you have no idea what it means, how they calculated what they calculate, how you would actually use it. And now you're just making shit up. And 90% of people just make shit up all the time. I make shit up. But 90% of people use numbers and research to try to say that they're smart, and they're just saying something that they don't actually know, and it's not actually impacting quality decision making. Like, or they can't prove that it's actually impacting quality decision making.
It's literally the same thing, Jake, you were talking about with strength training. Like, you're just over it. Like, you can keep going down the strength training rabbit hole. You can read as many books as you want about strength training, but at the end of the day, by getting to the end of that rabbit hole, is it going to change anything that you're doing regarding strength training? And that's the same way that what you're talking about now with data and whoop bands and HRV and catapults and tracking all this, is it going to change anything we're doing with the athletes? And it's like, the best athletes that are wearing all that stuff, this is cool. They don't care about it. Like, they're not worried about it. They're going out there being dogs. And what you're doing is stopping the kids that aren't dogs from becoming dogs, because those are the kids that are going to scrutinize over all these metrics and try to get their 8 hours and 13 minutes of sleep and have the perfect recovery score. And now they're worried about things other than being a dog, right? So the best kids don't care about it. All you're doing is stopping the kids that suck from becoming good and unlocking them. And that's like we're talking about, like, don't look at your mom in the stands. Like, that's going to be so much more impactful than me reading 100 more books about freaking strength training. Like, just getting this kid to stop being a little girl. Like,
We need to make shirts.
Yeah.
Don't look at your mom in the
yeah,
stands.
no, and I just like I got to take back now with today's day and age. Like the girls we train in our gym are way tougher than the boys. I just want to say that.
Mm.
But these kids, like, they just don't. Just go. No, well, what
Yeah,
about
there's I don't know if it was in the Nassim Taleb, the via negativa idea, taking something away instead of adding. If that was even accurate, his term, but um the soccer coach I've talked, Brian, he was the guy that really, when I met him, he changed everything for me. He actually he left. They had a bad year. And I talked to him a couple weeks ago, and he was telling me a lot of the issues they had. That, well, the reason why they lost, they had a ton of injuries. I think ACL tears, knee pains. I think patellofemoral pain. They were going to get imaging. Like the athletic training staff and the strength staff and him, they were not. It didn't sound good, and they were adding, like, people would get a pain. I think the knee pain one, and they're doing gait analysis, and they're fighting over gait analysis, and it's like, and for Brian, his thing was always removing. Let's remove. If these girls are beat up and we're trying to get them back to sport, let's do the bare minimum of weight room stuff to get them stronger. But we need to start counting how much time they're on the pitch, and we need to slowly progress that, and then obviously pay attention to symptoms and everything. But people are focusing on all this garbage, and you're focusing on all this garbage to try to help them. The gait analysis and the quad to hamstring ratios and stuff. You're trying to help the athlete, but I don't know if that is just stupidity on their end or what, but it's wrong.
It
And
could
that's
be
why they're
because it's
getting
their
hurt.
business model, right? To sell
It's
things like
got
this.
me. Well, all
Yeah.
I'm thinking about is, like, Rocky beat Drago, right? Who won that, right? And it's the same thing. There's a correlation between where these top soccer players, whether it's coming from Brazil or baseball players coming from the Dominican Republic or Puerto Rico, they're coming from areas without. Like, they're forced to create. They're forced to play. They're forced to experiment. They don't have all the things that we have here. And what do? They go do the thing.
Yeah, I wonder if it's the best. It's like this innate. It's almost like you can't really explain. We always try to explain why James Harden had that step back or something. But we don't know the answer of why he can pull it off. And we try to use eccentric strength, or his quads are so we try to, and it's like you're picking out one variable out of a million. We will probably never know why he is the way that he is. And I think those people that come from those backgrounds, they just do this. It is so simple what they do. They're just doing the sport, and there's something in them. And then
Dude, Jake, I had this conversation yesterday with one of our college players. I've got a kid right now that's a freshman in college. He plays at one of the top colleges in the country. He plays 25 minutes a game, and he's absolutely killing. On paper, he is not much more athletic than 100 other kids I've trained, right? What is different about him? And I'm sitting there 100% open. I have no idea. I don't know what makes him so good. How did he transition from high school basketball to playing in one of the top universities in the country? And he's destroying, and he's unwavering, didn't change. Just as good as he was in high school, he's that good now on the biggest stage, of his life, where I've had so many players where, again, on paper, they're the same. They're just as athletic, maybe more athletic, bigger, taller, stronger, faster. They struggle at the next level. He didn't. And I'm like, why?
And when they try to explain why, if, like, when people ask, like, a Steph Curry or a James Harden, like, what makes you so good, their interpretation of what makes them unique is also they don't know. If I had to guess, and something that I've said, like somebody like him, it's like, I think that they don't lose the plot, and I think that they are geniuses in the fact that they don't get lost. Genius in the fact that they don't get lost in the weeds. They are extremely locked in on what matters, and they have an infrastructure around them, a mental infrastructure that doesn't allow them to get distracted, so they could handle pressure. They have some players have like that, the way that they walk. They have the swag. They have something about them that allows them to block. Like, think about LaMelo Ball. There's something about him that allows to block out everything else, and he could just freaking put the ball in the basket. He just puts the ball in the basket, like, and that's it. And I think being a logical human being, if you're not trying to help a player get to a point Like, I'll put all my money on that. I don't need anybody to tell me what to do. I am going to try to get a player to eliminate everything that isn't the thing that they're trying to do and do as much of the thing that they're trying to do as possible and try to do things that they can't currently do that they want to be able to do. And if I do that and I can pay attention to all the things that aren't I think that's good. I think that's good coaching. I think that's what, like, inner game of tennis. What that he's talking to the guy, okay, I don't have to say anything to you about topspin. You just keep going. How can I do less or do more or do whatever I need to do to get you in a situation where you can be that person every single day that's focusing on the plot and you're not losing the plot? I think these coaches lose the plot. You talked about they're focused on the wrong stuff. I don't think they understand what focus is at all. I don't think they know what it means. I don't even think they don't even know what they're going for anymore. They're trying to prove something and they're lost in this rat race of trying to be smart, and they don't even know what they're actually trying to do. The guy's saying, okay, we're going to count how much they're on the court because he's saying how much they're on the field or whatever to see how that's correlating with pain. Like, that is like such a, okay, you have pain here and you have pain when you do this 50 times. Okay, let's start monitoring that because maybe that's a signal. Maybe that's something that's actually matters when it comes to your pain, and we're gonna actually matter. We're gonna measure something that matters. Their gait, like, how do you know their gait matters? You don't know. You have no idea what you're talking about. Zero clue. And they're probably like, what type of gait? Like, they have no idea what the hell they're talking about. Does their gait matter? How can they identify it? What do they even do if they think that it 100% does matter? Does it change their behavior? Like, they don't even know where to start. They lost the plot.
And then those are the people that are leading the athlete. Those are the people that are in their ear, like, yeah, and then what? The gate, to justify the gate thing, go and find pieces of research to justify a gate thing, and it's like, come on. You're going to find one piece of research to justify that. I'm going to find 5 pieces of research to go against your gate thing that showed that it didn't work. But this goes back, I think, everything you just said there goes back to the question of, should athletes that are healthy worry about tendon pain? And no, this is why. No, don't concern yourself with these things. Just focus on the one goal you have. I have a hard time, though, with this. I'm like, when someone does get in pain and it becomes a chronic thing, I think this is when you have to start to I don't know if you have to do this to them, but it's like they never were aware of their knee before because they just played.
Yeah,
but now this pain has stuck around for so long. So it's like they're hyper aware of it. And you kind of hate that because you want them to focus on the game. Just be aware of the game. Don't be aware of internally what's going on here. But I think that's just part of pain. You know, they have this, they're stuck in their body because of this pain. I think this guy, Louis Gifford, maybe, or something. I talked to Dave O'Sullivan, and his thing was, when you get done with rehab, he wants them to have thoughtless, fearless movement, and that's what it should be. Is they're back just playing the game. They're not playing the game thinking about their knee again and thinking about tendon health. They're back just playing the game. So it's like you have the kid just playing the game their whole life. They get this chronic case of knee pain, and that sucks. But you want to try to get rid of that as soon as you can so they can go back to thoughtless, fearless playing the game. And not many people do that when they get pain and then try to return. We don't do it either. I'm sure I have failed cases all the time of people that don't get better, and it's like they just pick up table tennis or something. They give up on basketball, so the knee is no longer an issue. But that's what kind of doesn't make it fun, but it makes it challenging to. What these mental blocks this person has, how can I get around them? But yeah, the making people hyper aware of something is just adding more noise. They don't need more noise. They need one thing. They need 2 things. They need let's do the good drills, and then let's go touch up on some weights. Those are your 2 things.
Clusters.
Yeah.
I love thoughtless, fearless movement. And if I think about the player I was referencing before, who was dominating, one of the top schools in the country right now, he's always been thoughtless, always been fearless. And it's like, how do I teach that? And I don't think I can't, I have no idea. You just keep throwing them in positions that make them think, that cause them fear. And you just hope over time, one of these experiences is going to get them, to jump that hurdle, because they're all stuck in that thought. They're all stuck in that fear. The only way to get through that is to be in situations that challenge your thought. that make you scared. And that doesn't even mean that they're ever going to get through it. I think that is the only way to get through it. But that, like, I'm just supposed to make these kids think and scare them every time they come in the gym. That's kind of what I do, right? But
Yeah.
sometimes
Yeah, it's
it
just
works and sometimes it doesn't.
exposure therapy.
Yeah.
Oh, it is. It's fake environments. If you're in a fake environment all the time and you're doing good in that fake environment, and when I say fake environment, it's not the actual environment in which you want to go achieve your goal. So if you're doing good in that environment and you keep getting positive reinforcement from it, eventually that is going to become the thing. Like you just said, table tennis. You're good when you play table tennis. You're good when you shoot in the gym by yourself. Are you good against actual people? You're good in the weight room. There's a lot of people that are good in the weight room. They could stack those numbers every single week, go up, up, up. It's very linear. It feels very safe in the weight room. Eventually, you become somebody that just lifts weights and you quit.
This is combo. When you ask us about like repping things out, this is why like it's hard for me to even entertain that conversation because I look at repping things out the same way I look at strength training, the same way I look at all this other things that I don't think are that important. Because like it doesn't matter. Okay, go rep it out. Don't rep it out. Do it our way. Do it their way. Do his strength training program. Do Ross's strength training program. Like, what matters? And that's what I'm after. I can't even tell you what matters. I just know it's not all that stuff.
No, and the repping things out. And I heard somebody talk about how they believes that not repping things out is like bullshit. And he's talking about how like watch Kobe, watch Kawhi. They rep things out all the time.
Yeah,
They're
but
really
it's not
good.
even about them. But I see what you're saying.
No. He's saying like, oh, you should go rep things out because they rep things out.
I don't agree with that. I don't think that's the reason. But go ahead.
Different people are in a different stage of their development. And you can contextualize things differently when you're in a different stage. And I think the biggest hurdle that most people have to get over is not more information, it's understanding what's actually important. And most players aren't good and they're not on the right path to becoming good because they do not understand what the goal is. They forget what the goal is. They train, but they still suck in games. When Kobe trains, he got to a point where, wow, I understand how to make myself train in a way that's going to make me good in games. And I think the biggest thing that we do is we're putting players in a situation where the only answer is focusing on what matters and you eliminate everything else. Bring up those distractions in that moment that are actually hurting you in games. And are you able to focus on the thing that matters in that moment? And I think that's what good players do. And I think that's the problems that bad players have. They can't focus on what matters. And they focus on something else. So when Kobe gets up reps or when Kawhi gets up reps, they're doing the same thing over and over again, they don't lose the plot. When somebody else does, they'll just be a robot and it's completely different type of training. The way they do it is different.
If you only rep things out, don't play your sport, don't put yourself in difficult decisions, that's bad. But two things could be true. I think you do need to rep skills out for volume reasons. Just like for volume reasons in your program, right? You need volume. I think you need volume when it comes to skills as well. And the best way to get volume is not game situation, even though game situation is important for flow and rhythm.
I think, they
volume,
just need...
Like repping things out allows you to get more volume. That's why it's important. Sharpening the skills. And then what you guys do is also really important as well. On top of that, to get the flow, to get the rhythm, and playing your sport and all that stuff.
We rep things out. We rep out finishes. We rep out like net tap, backboard tap. But the thing is, what we're doing is we're saying, okay, they're getting back in line right away. They're getting plenty of reps. But it's like, how can we challenge this skill?
Yeah.
And what is the focus of this skill that we're actually repping out?
Yeah, I think that's good. But you just said getting back in line, which means you're getting less reps.
It's like Jaden Holman. Like, what happened with him? Like how did he develop? Like his dad he got unlocked. How did he become unlocked? I don't think it's anything extremely specific that he got from us, more athleticism, more. Yes, all those things happen. But I think the thing that happens with players is that they become unlocked because they understand, okay, this is what I need to do. And it seems obvious, but when you're actually doing it, it's not obvious. It's not easy.
It's removing, right?
Different players need different things too. Different players need different things.
In terms of what? Like different players need different things. I think development is development, and that's why we have we train by principles, right? We have these ideas, these thoughts, these principles that we believe are important. and we want our
I
players
believe
to
they're
understand
important. I believe they're important.
I want players to understand the principles. I don't care if they're repping out certain footwork. I don't care what strength training program they're doing. I don't care. It doesn't matter as long as they understand what it actually takes to get better and that they have a clear vision of where they're trying to take this game. So
It's like being on the path rather than working
Yeah.
on the path. Being on the path rather than working on the path. Like anybody can go look up any information they want. How do you figure out what information's important?
remove those barriers. Like, how do we unlock these kids? We remove barriers. Go do things you've never done before. Go try this. Oh, you got to dunk. That sucks. Go dunk with 2 hands. Oh, you got to dunk with 2 hands. Not good enough. Go windmill it. You got to windmill. Not good enough. 360 windmill. And it just never ends. Just never stops. And if you can get that to seep into their minds, that it just never ends, I can always do more, I can always push further, then they're on the right path. Then go rep out all the stuff. Go rep out your step back. Go rep out your mic. Go whatever. But if they
Right hand,
none
left
of that
hand,
matters
euro,
if they're
floater,
freaking full of
has he
fear
right,
and thought.
has he left?
None of it matters if they're still thinking and
Of
they're still full of
course.
fear.
If you can't hoop, you can't hoop. So if you can't hoop and you rep things out, you know, you have to be able to
But
hoop first.
that's a trap
like
they fall
like
into.
to me, playing your sport's the most important, right? But I think different players need different things.
It's always a rep out.
Anyway, Jake.
Anyway,
See, this is what we do.
this is what we do.
Yeah.
We argue about
I had
repping things
I
out.
had a question. I had a question on that, but I don't.
Now go ahead.
No,
ahead.
go.
I know Bobby. What was that podcast on? What's that called outside of the monotony? The action. What was it called?
Perception Action Podcast.
Perception and action.
Rob
Yeah, perception and action. So it's like it was like a big thing for a while. Probably still is, of like the repetition without repetition. Where do you guys stand with like is there value in the monotony of doing the reps, or do you get is it? I feel like there's value in monotony, doing the same exact thing over and over. But I don't. Where do you guys stand with that?
It in terms of what? It takes time. It takes hours. It takes dedication. It takes obsession. It takes time in the gym. It takes grinding. I'm not trying to negate any of that.
You got to tie up the loose ends sometimes. You got to tie up the loose ends.
But does what you're doing, repping the same footwork out over and over, does that tie? Is that the loose end that we need to tie?
Depends on who you are, and depends on what kind of loose rep, and it depends on what options you need as an offensive player.
It depends.
Yeah.
I think one of the biggest problems when answering questions like this, and back to your point that you made before, is that we don't play competitively. I just saw a picture of myself at my parents' house playing in a game, playing in a college game, and it brought back memories of like, oh, this is how I felt. Like this is what this is probably what was going through my head in this moment. We're not in those competitive moments where things are on the line. We're trying to get more minutes. We're trying to also win. We're also trying to not get taken out of the game. Like there's all these things that are happening. How are you preparing for that moment? I think if we were just preparing to be better in practice, the way we would train would be completely different. The way I would view training would be 100% different. But at the end of the day, there's only one time where it actually matters, and that's in the game. And when you're in the game, when there's all this pressure going on, how are you able to actually execute? Not just the fact that there's perception action coupling, not just that fact, but that fact is true. Not just that, but the fact that there's also, you don't get the context of the previous rep in a game. In training, you get the context of a previous rep. So that's not to say that repping things out over and over again isn't good, because maybe you're working on some type of demand. Doing squats, 10 reps of squats over and over again is good. You're getting something out of it, right? You're at some point you learn something in some type of way. But at some level, you do have to say, what are the actual demands? What are the things I'm going to be facing in a game? And am I preparing for that in my training right now? And I don't think a lot of people do. A lot of people miss the plot. And the people that are good are able to train in a way that prepares them for the actual game.
Yeah, I mean, let's look at Amen Thompson or Ben Simmons. Already great feel for the game, already really athletic. They probably need to rep out some skills. Like you could put them in game situation drills. They're already great in game situations. They know when to make a pass. They know when to do this. Like they have great feel for basketball. They're great athletes. But they need to tie up the loose ends big time because they don't have enough options in terms of skills.
Well, it's not just game situations and then reps. It's like we rep things out. Like I said, we rep things out all the time, but it's not just.
So we're in agreement. You need to do both.
But
there's functional training, there's operational training, and I think that you need to do a little bit of both.
But to say that there's inherent value in the reps, I don't know if I 100% agree with that. I don't know if there's inherent value in the reps. Is there inherent value in the intensity? Potentially, maybe it's something of both. I don't think that there's inherent value in reps. There's not inherent value. If I just get up reps of what? Like if I just get up reps and there's no intensity, I don't think there's inherent.
Of course you need intensity. Yeah,
that's what's going on. That's what's going. So what's intensity mean? What does that mean? And what are the demands of the sport? What's the thing that needs to intensify in order to reach the demands that you're going to be facing in a game? And what are the demands?
Mm-hmm.
What's the difference between training and the game?
Yeah.
You know?
Yeah.
We believe growth happens at the edge of your ability. So if you're training and you're repping things out, what ability are you at the edge of? Right? What is the challenge there? Now, I can have two players. One goes and does 10 reps over here. One goes and does 10 reps over there. This player over here is experimenting every single rep. Same step back move.
Is he good at basketball yet?
They're both good.
Oh, they're
They're
good.
both
Okay.
good. They're both good.
Okay.
All right. This player over here, he's doing every single rep and he's acutely aware of how he feels. He's getting that feedback from the ball. He's trying different things. He's trying to move further. He's trying to play higher. He's trying to play lower. He's changing his speeds. He's trying to swish the ball. And this player over there is going to go do 10 step backs. Which one are you going with?
Well, it's not just the 10 step backs.
This is my analogy. No, it is just
there's
10.
a lot
He's
of
gonna go do 10
there's a
step
lot
backs.
of different things you can work on
Because
when it comes to repping things out.
That's
There's a
not what's
plethora.
happening, though. That is not
There's a
what's
plethora
happening. Players are
of
going,
different
and
options.
that's not what's happening, though.
Plethora of
They're going
options.
there and they're checking a
Need all
box
of
of
them.
getting 10 reps.
The best offensive players have
The
all
best
the options.
offensive players is
have
who
all
I'm trying
the
to
options.
create. That exactly.
Kyrie has every option you can think of,
Exactly.
and then the options you can't even think of.
Exactly. That's what I want.
And he reps them out.
That's what we're saying. That's what we
Right
want.
hand, left hand, right foot, left foot, floater, Euro, everything.
but go
all
do
of
everything.
it. 3 levels.
But
That's my
here's
point.
the thing. Here's the thing.
He has everything.
When it comes back to like what is like to say that 100% because he rep things out
Not only because of that,
but
two things could be true.
But because he reps things out, the reason why he's able to do something in a game is because he intentionally worked on it in training. While I'm not saying that that's bad, but I'm also not saying that that's the specific reason why. I think everything that you do in training is at some point you're working on a demand of the game. And if you're not working on the demand of the game, it's not going to happen in the game when that demand is present. It will not happen. Doesn't matter how many euros you do on air. Doesn't matter that he worked on, with no one else in the gym, a right to left euro and finished. That didn't give him the ability to do that in a game.
That on top of playing your sport.
I don't think so.
On top of
I don't think it does anything.
It's his like
I don't think it's
broad
that-
view approach on how he just goes about life, how he goes about his career from an early age. What was his mindset? What was his intention? How did he just operate on a day-to-day
I don't
basis?
think what you're saying is wrong.
It's everything.
Okay.
It's everything.
I don't think it's wrong.
And now you do reps. Yeah, he's gonna be great because he has all the other stuff. Anyway, Jake, welcome.
Welcome to
How
the
you
good
doing over
pod.
there? Yeah.
I feel like it's confusing stuff for me, but
Yes.
I feel like he's so much better than a number of his defenders that he's just playing. Is he just playing with them?
Yeah.
That like so the whole thing about being thoughtless and acting. I bet you there are moments where he's really thoughtful because he can be, because he's so good.
Yeah, he could do
You know
it
what I'm
either way. Yeah.
Yeah.
He's like, he could say, I'm going to
And he's like playing with his food. Versus
could
a lot of
see-
players can't play with their food. They have to try their hardest.
Yeah.
Oh, Kyrie's one of the guys that can look at his defender and say, "This is exactly what I'm going to do to you."
Right.
Let him know, and then go do it. That's how good he is. And you still.
So
can't
I feel
guard
like that's why it's hard. It's hard to take these I don't want to say outliers, but like guys at the top, and it's like
And then that could also
What if
hurt,
we- what if
that could also hurt a player by being premeditated if they're not Kyrie, right?
But the thing that allows him, if he was going to
making a
premeditate,
face,
there
I'm
is
agreeing with you.
there
thinking.
is something that allows him to premeditate. So it's like, what is the thing that does make him good? There's something about him. He was, and
It's a lot of things.
It's not really a lot of things. It all comes down to speed. Like, so his ability to get to a spot and execute something, and if he's going to premeditate it, that's all speed. 100% of it is speed, whether it's speed of however you want to classify speed, it's speed 100% of the time. If he says it's literally a constraint of time. The variable of time is the reason why you're able to do something in the game. You're able to get your shot off at a certain period of time. Of course, he makes it. He makes it, and that's a skill within itself. That's different. But the fact of being able to go do something with the defense on you, it's all about time and beating them to a spot, beating them to the spot here, beating them to a spot on the ground. It doesn't really matter. So he has something physically about him, whether it's the way he moves, the speed at which he moves at, tendons, anything. It could be anything. Could be a bunch of different things, and we don't really understand what it is. But he has something that can overcome the demands that most players can't overcome, which makes him Kyrie. He has things that allow him to do that.
Yeah, so it's like you guys are almost the way you're taking the game and then trying to be very close to the game. It's like that the whole approach versus the part approach, right? The part approach is like let's isolate all these 100 different parts and then put the parts back into the whole, but it doesn't work. Because the whole is too complex. The whole is too complex. The whole is greater than the sum of the parts.
If you don't have context, it doesn't work. If you have the context, I think it works. I think the way if I were to go get up shots like from one spot and shoot the same way every single time, I would do it very differently than a fifth grader. We're both doing the same exact thing. The way I do it, I think to say that it's 100% not different just because we're doing the same thing visually that's ignorant. I think that's definitely ignorant. I think that I have a different context about the way I play, the way I am, that will make it different. And I think when people we start having this conversation about reps, it's not just, go do the reps. I think that there's certain players in our gym that come to my mind that if I were to tell them to go get up reps, it would be a complete waste of time, borderline hurting them, borderline turning them into robots. Some players. Yes. Other players, the players that will get a benefit from the reps, you don't need to tell them to get up reps. You don't need to tell Kobe to go get up reps.
Somebody needs to tell Ben Simmons.
I don't think
to get the right information.
I think that's ignorant. I don't think that's true. I don't think that we know that that's true. I think, but I know that there's certain players in our gym that if you tell them to go get up reps, they're going to do it a certain way, and it doesn't get them the results that they want. There's players all over the world that are doing the same thing over and over and over again, and still not getting the results in actual games that we deal with.
Yeah. I mean, I think what you're saying is not wrong. You need to have a great feel for basketball. You need to be put in difficult situations. You definitely need to play your sport. We're all in agreement to that. You have to play your sport to be good at basketball. You have to play basketball to be good at basketball. That's for sure. But all the parts of a car make a great car, and I think you have to sharpen all of them, and then add options to your game.
The difference between a car and a human, though, is that a car is something that's outside of you, and it's a logical-based framework. If I'm going to go break down a car, I have to logically understand all the parts. I have to because it's not me. But internal mechanism, that's not how the internal mechanism works. I don't have to understand that I even have a brain for me to be able to use my brain. That it's a very different framework. It's not a logic-based mechanism. It's not a logic-based it's sub-logic.
I think
it's subcortical.
If you're good at basketball already and you've repped out good options, those options will come out naturally in the flow of a game.
I think the times where I was trained this way, and the times where that did happen, I pointed it out and I noticed it. Wow. And a lot of coaches do this. We worked on that move.
Yeah.
And the reason why they do that is because it's a shocker that you actually did that BS training and something actually happened in the game by accident because you did something in a weird situation and you were able to get an in and out and then finish with the left hand so perfectly. It's a shocker that happened just the way that you did it in that robotic setting.
Why is it a shocker?
It's a shocker because it never happens. It never actually works out like that in games.
I don't know who that's for. I mean, it sounds like a specific person that is not good at basketball. That's what it sounds like. If you're that happy about a guy making a layup, he's not good. Right? Who's that person?
I do think that there's a way, from most people, there's a way less understanding that there is something more than just the fact that you have to go check the box and do the reps and get up all the options. Yeah. And there's something more. There's something that makes
definitely. I agree.
The goal of players is not to is to go do what? What does everybody say? They want to play what? Division I basketball. That's what they want to say. How are you going to become a percent of a percent? Everyone's getting up the reps. Everybody's doing this. It's like, how do you put them on the path to get there?
If you're training like everybody else, you'll just be like everybody else. I agree with that.
Yeah. So it's like, what are the things that actually matter here?
Winning.
Yeah. It's like, what are you focused on? How do you not lose the plot? How do you win? How do you dominate? How do you, like, what does that take?
Go win. Figure it out. Win. Ultimate skill. Go freaking win. That's it.
There you go.
Anyway, Jake. So you want to talk about tendons again or what?
No, I don't know where I'd go. This has gone far from tendons, but
yeah,
which is good, right?
Pasture-raised tendons, real quick. You were talking about pasture-raised tendons, horses out in the pasture. right? What can humans take from this?
Mm.
And if you want to unpack this pasture-raised tendon thing real quick, and then
Let
we'll
me,
call it
yes,
a day.
but the guys that go do the reps and get something out of it versus don't, is the difference? What's the difference? The ones who are thinking of game situations and the other ones are just going through motions?
I think
you need both.
Or like they have a framework in their head of like this is what I'm going to do in a game versus the other ones like I'm just going to do the rep.
That's if I went out and repped out something right now, it would be beneficial. Just on how I'm approaching those reps, how I'm thinking about those reps, the value I put on those reps is different than the value a lot of people put on the reps, right? It's like, I'm going to go rep out this thing 100 times and therefore I'm going to be a better basketball player. And it's not like that.
You
It's
can't
not
just do
you
that.
can't,
Yeah.
but that's what the thought is I'm going to go automate this move. So I got it in my bag and then I'm going to be able to recreate
those
this
guys aren't
automated thing when I go out on the
they're
court,
not
when there's
good.
5 guys on the court, 2 refs, stands, people making fun of me, guarding me, double teams. It just doesn't work that way. You're not going to automate a move and then be able to reproduce it in the game the way it just doesn't work that way.
To further that, it's not that it's just more important. It is useless. It is useless for a player to say, I am going to just get, like, what do a lot of people do when they get up shots? And just to bring this back, what do a lot of people do? They get in a rhythm, right? They're shooting. Okay, I'm just going to think about like my girlfriend while I shoot. And like, that's what people do. They'll think about like, oh, what am I eating for dinner later? And they shoot. There's no presence. They're not present, right? They're not in that moment. They're not saying, what is my goal right now? What am I trying to do? Am I actually achieving what I'm trying to do in this moment? And a lot of people, when they say reps, their goal is the reps. The goal is the reps. The goal isn't to get better. The goal is the reps. The goal is not to say, how is this going to translate in games, even though they say that's the goal. The goal in that moment is, okay, 88, 80, oh, I missed that, 89.
Yeah,
and that's their goal.
Yeah.
That's what people do.
Yeah, it's not good.
They'll go, I'm going to
Yeah.
get 10
Yeah,
makes
that's
each
not good.
spot.
That's not good.
What's happening to get those makes? Right? I'm going to get 10 makes each spot.
You know what? I think what makes a good player just doing spot shooting, 10 reps each spot, and that's it, and never playing basketball, and never like that. That's what I think.
I'm not saying that. I'm saying this is what they think.
That's bad. Then it's terrible.
That's what I'm
wait,
saying.
I know you're talking about people repping out things that are terrible at basketball already. Yes, they have to get better at basketball too.
There's a something missing here, and I can't put my finger on it because it's not that you.
It's
I'm
the
not
combination
attacking
of
you.
all.
I'm not attacking what you're saying. I'm just saying. I live, breathe, eat this. I am freaking in this in high school gyms. I'm in my gym 5 days a week. I've worked with players on the court, shitty ones, good ones, everywhere in between, all different ages. This is all I've done for 12 years, and I'm just saying, I don't even know how to communicate what I'm saying. But it's not the commonality between the kids that stink is they're going out there to check a box or do something a certain way, and they're listening to the coach. The coach says, "Oh, if you do it this way, it's a little bit better." You know, and they're going against nothing. They're practicing moves on air. And now coaches are giving them this feedback that means absolutely nothing. As Ross alluded to before, if you just get your elbow right here, you'll make more shots and be able to have more range. It does not work that way, but it's like, it's just been done. Talking about form, talking about whatever, footwork.
They're trying to get a good workout. They're trying to get a good workout.
If you put
trying
your
to get a
feet
sweat.
here instead of here, you're going to be able to do this when you play in the game. That is not the communication loop between a coach and an athlete that is going to get that athlete to perform at their best. The communication loop is more shut the hell up and go, right? Stop, go, kill. You're open, shoot, drive, play, become present in the moment. And the players that can understand that, now when they're in the gym themselves, repping things out, they understand that idea of being present in the moment, and they're in tune with what's happening, whether it's on the court by themselves, whether it's playing ping pong, whether it's freaking recording a podcast. They have the ability to go to any situation they're in and absolutely dominate. The players that suck, I don't care how many reps they do. I don't care how much time they spend in the gym. I don't care what strength training program they're going to do. They're always going to suck unless they can be unlocked.
Well, Jake.
So that's the okay. I don't know if we'll ever get to the bottom of it. I'm trying to
Me
understand.
neither.
I'm trying to understand a bit.
You
but
start this whole thing with repetition without repetition. It's good. And you know what? Some
Yeah,
days I might want to
yeah.
go in the gym and give them repetition for the sake of repetition and monotony just to see how they respond to it. Right?
Yeah.
I'm looking at the learner. What's happening? How can I challenge this learner? How can I create thought? I got somebody that you know, that loves to do whatever they want to do.
Yeah.
I'm going to make them do it my way this day just to see how they respond to it, because they're going to play for a coach next year that's probably going to want them to do it their way. Can you respond to that, right? Can I throw, how do I mix in failure? How do I make them think? You talked about thoughtless, fearless.
You definitely don't want to develop skill development robots. I agree with that 100%.
Yeah.
I agree with that 100%. Yeah.
What do you guys think? Wasn't there research on free throws that the second free throw percentage is much greater than the first? You guys aware of this?
What do you think about that?
Makes sense.
So I'm just thinking that you take, and I think Bobby's whole thing goes a lot deeper than this, because in a way I can't explain either. But the free throw thing is like
nobody could explain what Bobby said.
let's go. It's like
People can. People can.
let's work. It's like let's work on free throws. Let's go shoot 10 free throws. Versus is that situation is very not game like. The
Everybody
real
knows
situation
that.
is
Yeah.
Well, exactly. So it's a very basic example, but
it's the one that everybody talks about. But then when they apply it but if you try to apply it to anything else, then they don't talk about it. Oh, let's go shoot 10 free throws. You go 9 for 10 in practice. Why are you a 33% free throw shooter in a game? Happens all the time. Rob Fodor talked about it. Rob Fodor brought up with Hassan Whiteside. Hassan Whiteside was shooting like 50% from the free throw line in the first half of the season. Second half of the season, he says, okay, Hassan, we're going to shoot 2 free throws at a time, because that's what we do in games. And we're going to separate. We're going to have time between each free throw. And he manipulated where Hassan was shooting, which baskets he was shooting at. He changed the baskets. And he also manipulated where he was shooting at based on where the media coverage was at the end of practice. So at the end of practice, there's like all this media. And then eventually it clicked for Hassan, like, okay, I get it. There's an unlock moment. That's what he's describing. There's something that happened where it's like Hassan had a light bulb go off. It's like, I understand why you're doing this. I understand the plot. I understand what's going on. I understand what I should be focused on right now, that there is pressures around me and I have to see that, but still just put the ball in the freaking basket. I don't have 10 repetitions. I don't have reps 5, 6, 7, 8 to draw from 1, 2, 3, and 4. But that's how a lot of people train. They draw from the previous rep, but the game isn't a drill. And so that's one part of it. That doesn't mean that reps are inherently bad, but that's just one piece of what's going on.
Yeah.
Yeah, I think it's an obvious one that what's game like, you should try to replicate, like, start with the end in mind, the game. Let's try to make the training like the game. The further away from that is probably, I wouldn't say bad, but it is bad.
To go one
Maybe
step further,
bad.
though, it's not just replicating the game, because then if I have to replicate the game, that means I have to get in my car, drive, go to the stadium, get dressed, get warmed up, take 2 hours for the warm up. It's what is the actual, that sounds ridiculous, but what is the actual thing that's going on? You're trying to replicate the specific demands that are stopping you from achieving your goal, and you're trying to overcome constraints that you're facing. And it's like, what are the actual problems that you are experiencing in games that aren't allowing you to shoot 40% from 3, that aren't allowing you to play 25 minutes per game, that aren't allowing you to dunk on somebody's head? Whatever your goals are, what is the problems that you're having? And then what are you doing in your training that's actually creating some type of adaptation, some type of change in you that's allowing you to do those things?
That's I'll bring it back to tendons with this. I haven't seen it for myself, but the guys with really compromised Achilles and patellars, they won't decelerate off that side. They won't accelerate off that side patellar. They won't accelerate off that side Achilles, or probably jump, because the Achilles is more of a propulsive forward. The patellar is more of a stopping, and it's something you wouldn't even know. Like consciously, an athlete wouldn't know that. No. You're not pushing off of this side. You've warmed up, the pain is gone, and you're just going off the other way. So that's where, having a smart staff that could actually pick that stuff out. Yeah.
All right. Last thing, Jake. How do staffs get smarter when it comes to strength and conditioning?
Oh, follow my Instagram.
There you go.
Got it all.
Instagram.
Yeah. Check out my memes.
Strength and conditioning. How do they get smarter with that? I mean, I all I post is tendon stuff, which is
you went through phases of what you're interested in, right? Basically.
Yeah. And I mean, the strength is basic. Bobby's going back on the 1x20. I was into that for
me too.
How long? How many years? 2017 maybe.
Get the good drill out.
7 years ago. But it's still good.
No, he's got it.
It's still good. It covers it all. How can they get better with strength and conditioning? I think that phrase of begin with the end in mind. I didn't. I learned a lot about strength conditioning from other strength coaches, and then I realized they're all just telling lies and they're making things up and they're making things more important than everything else. When I met Brian, the soccer coach, that was what changed everything for me because he was all about winning soccer games, and he looked at me as like a guy to help him. So all the things I was doing in the weight room for like hamstring fascicle length or something, we're not doing those anymore. Those are stupid. We're first of all starting with how much practice load they have and whatever. And he was like big guy too of the perception and action. There were no kicking around cones. There was no kicking back and forth. Everything was a game. Even the warm up was roll the ball out and you got 10 seconds to try to score like 3v3, whatever it was. A lot of it was perception and action. And I think I was going to ask this earlier, but I think it gets rid of the boredom. How many athletes are bored of just doing reps, bored of the reps? So I'm always curious, is there value in the monotony of reps? Probably for the certain individuals, but when you put in game scenarios, there's no boredom. You're engaged. You're engaged right away. And that's good tendon training. The pasture-raised tendons, those are like young horses who are playing because they enjoy playing. And if you can keep people enjoying playing, how many more? Like I watch your guys' gym sessions and the strain, the pull on the tendons, because the stimulus in the gym is so high, you're getting those tendons so much more conditioned than they would get by just going through some rep. Because they're just not pulling on the muscles aren't working as hard, the tendons aren't pulling as hard. So it's like you want to replicate the game. I think strength coaches, injury prevention is impossible to track, but I know that I've prevented a ton of injuries in my life because I've given people good strength and conditioning. And for you guys to try to prepare them for the impacts of sport by getting the environment, the stimulus so high, you're stressing their bodies so hard that they're probably much more able to handle the stimulus of sport without breaking something or tearing something down because they're exposed to it more often. When I really started to put things together in the strength world and then kind of give up on it and retire was when I met a sport coach. So yeah, getting around this, and I don't even care about soccer, but I care about basketball. Being around him was just like, the role of strength conditioning is made up. We don't need this silo. You need someone who wants to get someone better at the end goal, which is to win the game. And if that means we're taking away a lifting session for this week, that will hurt every strength coach in America because they think strength conditioning is, but for me, I was probably the best person that ever worked for him. For me, I was like, cool, I don't care. I agree. Let's not do lifting today. They can go
spike ball.
They can take it off.
Yeah, when I played overseas, we used to play soccer in basketball practice. So
Spike ball.
all right, guys.
But I think of the repetition. Like I started in the warm-ups. Like the warm-ups you see in every doing lunges and lateral lunges and bear crawls. Everybody hates it. Everyone hates it. Maybe like once a month you can do it and it's some type of variation, but nobody is engaged. That's not getting you pasture-raised tendons. It's not doing anything for your body in a development. Sure, you can do the movements. Let's just make sure you can do that. But if everyone hates it, the brain and the body are the same thing. So if the brain is like, this sucks, what kind of stimulus are you giving the body? Nothing at all. So you break out the spike ball and they get carried away 2 hours of spike ball. You just got cardiovascular, muscular, tendon. You got all the systems covered instead of doing some stupid scientific-based warm-up. So I still, I got a lot of things that I think are wrong and stupid, but that's one. The dynamic warm-up is definitely one.
Okay.
That's good.
Good stuff, guys. Jake, thanks for taking the time. Where can we find you?
You find Jake Tuura. Just search the name Jake Tuura. It's all over. Tuura.
Everywhere.
Instagram, Twitter, YouTube. Not TikTok really, but yeah.
I love the program.
And soon the good knees. What are we going to call
program?
it? Good knees. I'm right. Yeah, I'm working. Well, we got to have another chat about it at some point. I need a little bit more information.
I love the program though. I've been doing it. I'm on phase 3, and thanks for taking the time today. We appreciate you.
Thank you.
Yeah.
Thanks, Jade.